I would like to know what could be done about my under eye area at the young age of 21. Hi, I seem to have a mix of under eye bags and hollow eyes. Please correct me if I am wrong. I am 21 years of age, and I feel as though they make me look a lot older than I am, and also very tired. I am the only one in my family to have such prominent bags under my eyes, which I find quite unsettling, especially as I am the youngest in the family. Please, may you advise me on non-intrusive and intrusive options? Thank you so much.
Thank you for your question. You're 21 years old, and you describe in your question that you appear to have a combination of under-eye bags and hollows. You've submitted a single photo where it's on an angle of showing your eyes, and it appears that you're smiling. Well, I can certainly give you some guidance about your concerns. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And as a little bit more explanation about my background, I come from a training perspective of first studying ophthalmology or eye surgery, and then specializing in plastic surgery of the eyes and face. So as you can imagine, in 20 years of practice, I have a lot of experience with your type of concern. So to begin with, it's important that you have a sense and understanding of why you have both an under-eye bag as well as a hollow. So to begin with, when I look at your photo, it appears that there is an area under your eyes where you have a little bulge of what appears to be orbital fat, or sometimes referred to as lower eyelid fat prolapse. Now, what does that mean? Lower eyelid fat prolapse means that the fat that is normally around your eyes pushes forward, and when it pushes forward, it creates a bulge. Now, that bulge appears like a bag or bags under your eyes. What is the reality in terms of the common causes of this is basically is genetics. When we look at someone as young as yourself, it's not necessarily what people assume as age-related, but rather a genetic trait. In fact, a lot of patients who come to me in later decades will say, I've had these under-eye bags since I was a teenager. Now, when you understand the anatomy of fat pushing forward, you then get an understanding of why there's also a hollow. With your eyes at rest, looking forward, you might appreciate more the hollow relative to the under-eye bag. Why? Because the bag creates like a mountain effect, while underneath it there's a relative hollow. So it's like a mountain next to a valley. Now, at 21 years old, it is important to at least understand your options before you move forward with a procedure, or for that matter, any age. But with someone with darker skin who's young, there are basically two options that we will often present. The first option is a more definitive option. And that definitive option is to address the lower eyelid fat prolapse by doing a procedure called a transconjunctival blepharoplasty. What that means is the fat pockets that have pushed forward is addressed from behind the eyelid. This way there's no incision on the outside, and although it is a surgical procedure, it's considered in experienced hands to be a relatively minimally invasive surgical procedure. It is still working around the eye, but it is addressing the underlying problem directly. Which brings us to what are some approaches that are indirect. Well, indirectly, you can buy some time before moving forward with surgery, and you can even try this as a way to improve the appearance. And what I'm talking about is the placement of a filler in the relative hollow under the eyes. Again, you're dealing with a little bit of fat that's pushed forward, but that creates a relative hollow adjacent to that fat pocket. Well, a strategy to improve that hollow is to fill it with a hyaluronic acid filler, such as Restylane. Now, the techniques of doing this vary from doctor to doctor, but in our practice, what I do is I try to do this with minimal trauma, and we use a method of something called blunt cannulas to minimize bruising and swelling. Now, that being aside, it's important to at least understand what's the longevity of this type of procedure. Well, that's a bit of a tricky question, because with fillers under the eye in this area, they can last anywhere from 6 months to several years. So there may be a benefit, especially if you have just a mild amount of fat prolapse, to try a non-surgical option, such as the placement of a filler in this area, often referred to as the tear trough. So you have basically two possible options, and of course the third option being doing nothing and waiting to do something. But at least when you have an understanding of the surgical option and the non-surgical option, you can explore what appeals most to you based on a proper examination, based on what is financially and logistically feasible for you, and then move forward. I would suggest you meet with qualified and experienced cosmetic surgeons, and I stress the word surgeon because I think that there is, at least with a surgeon, the doctor who has a lot of experience with the under-eye bag issue will offer you both a surgical and non-surgical option, as opposed to the doctor who doesn't do this type of surgery, who will push you towards a non-surgical option only. This, unfortunately, is the bias of physicians when it comes to the scope of what they're able to offer you. So it's my bias that someone who can do everything will be less biased, depending on their personality, of course. So meet with a doctor you feel comfortable with and explore these options, and then take it from there. So I hope that was helpful. I wish you the best of luck, and thank you for your question.